Hello and welcome to the overview of the General Surgery Department. Let's go through a brief history of surgery before we begin. Surgery began as a barber's trade. During the Middle Ages in Europe, the practice of surgery was not taught in most universities. The barbers instead wielded the knife either on their own responsibility or upon being called into cases by physicians. The organization of the United Company of Barber Surgeons of London in 1540 marked the beginning of some control of the qualifications of those who performed operations. This was the precursor of the Royal College of Surgeons of England. By the end of this session, you should be able to understand and explain the functions of the department, identify the team players and their respective roles in this department, learn how time can be managed well while training in this department, recognize the roles and responsibilities of a house officer in the Department of Surgery, understand and manage the expectations of being a house officer here, and last but not least, understand the pathway to specialization in this field for those of you who might be interested to understand the journey or maybe live one. Let's get started. The word surgery comes from an ancient Greek term called share, which means hand, and ergon, which means to work, as well as from the Latin word chirurgia, which refers to the treatment of disease, injury, or deformity by manual or instrumental operations as the removal of diseased parts of tissue by cutting. So, in short, surgery is the act of putting one's hands to work in the treatment of a patient through the means of cutting. Surgery is a medical specialty that uses operative manual and instrumental techniques on a person to investigate or treat a pathological condition such as a disease or injury, to help improve bodily function, appearance, or to repair unwanted ruptured areas. General surgery is a clinical specialty that manages surgically related conditions affecting the gastrointestinal, hepatobiliary, breast, endocrine, and vascular systems, trauma, and wound conditions which may present acutely or electively. In addition, general surgeons are the primary providers of polytrauma management as well. There are four major categories of surgery: wound treatment, extirpative surgery, which involves the removal of diseases, tissues, or organs; reconstructive surgery, which deals with replacement of lost tissues by reconstructing the organ or tissue using prostheses; and transplantation surgery, which involves the use of organs transplanted from other bodies to replace diseased organs in patients. When we say the Department of Surgery, this usually refers to general surgery, which is a branch of surgery that covers main areas of surgical treatment. These include diseases of the chest, abdomen, breast, head and neck, blood vessels, and digestive tract. The diseases can include tumors, injuries or trauma, infections, or even involving vascular insufficiency. Should further intervention or more specialized surgery is required, case will be referred to the subspecialties of surgery to be managed. There are numerous staff and service providers working together in the surgical team to ensure the objectives of the department are met. It is advisable to be well aware of who your team comprises and what are their respective roles as part of the surgical team. Let's begin with the doctors. The department head, which is the head of department, usually holds a post of a consultant. Otherwise, the post can also be held by a surgeon in training. The head of department runs the department, essentially looking into the financial needs, resource needs, and overseeing the day-to-day activity of the department. The head of department is assigned to ensure that the department is running smoothly, and they also play an important role as a representative of the department to important meetings, raise issues to the attention of the hospital director, and manage the department's budget to ensure adequate medication and equipment are available. They are expected to be enthusiastic in the research arena of their field to drive development and advancement. Next, we have consultants. The ward consultant surgeon leads ward rounds at least once a week. The consultant oversees the patient's diagnosis, investigations, and treatment plans. He or she also troubleshoots difficult medical problems. Then we have the surgeons. Surgeons conduct pre-operative and post-operative ward rounds daily. He or she leads a team of doctors during the rounds, and their main role is intervening in an operative or surgical approach. New cases, which are admitted from the emergency department, are reviewed by them, and surgery is decided based on the severity and diagnosis. There are instances where cases are managed medically, however, quite rare. The surgeon then concludes a management plan and conveys the progress of the patients to them and their families. The surgeons or specialists here will be your assessors at the end of your posting, and they will also supervise teaching and CME sessions. Finally, we have the medical officers, which is your one-up who reviews the patient with you before the surgeon arrives. The cooperation between the medical officers, house officers, and nurses is essential in ensuring patients receive holistic care during their stay in the ward. It is advisable that the house officer brings forth any setbacks pertaining patient care or management that he or she may face to the medical officer in the ward before the surgeon comes for their rounds. Let's look at the nursing staff. The nursing staff in every department is led by the matron of the department. They are in charge of the nursing service division and are directly accountable for the proper organization, direction, and coordination of nursing services. They are the nursing representatives of their wards to raise issues to the hospital director. Then we have the ward sister, who reports to the matron. The ward sister organizes all nursing activities of a unit in accordance with hospital policy and rules. The ward sister also directly supervises patient care of the unit and provides direct care to seriously ill patients as and when a situation arises. She takes care of the well-being of the nursing staff team, and she manages as well as arranges the rosters for the nursing staff. She's in charge of ensuring all the records of the patient-related diagnosis, condition, and treatment, and ensure proper maintenance of the records. The ward sisters are usually dressed in light blue. Then we have the ward nurses. The nurses are divided into staff nurses as well as community nurses. Nurses provide direct patient care in terms of bed making, changing of bed sheets, mouth and oral care, bathing the patients, and changing their positions. Ward nurses are responsible for obtaining patients' vital parameters and charting them on the observation charts. He or she will provide comfort to the patient and maintain the safety of the patient as well. He or she will take over the charge from the duty nurse of the previous shift regarding patients, instrument supplies, drugs, and hand over the same to the next shift. Every day, one of the nurses in the ward will be assigned the medication administration role. He or she will be stationed by the medication trolley to prepare and dispense medications to patients. Next is the allied health professionals, who are the pharmacists. Ward pharmacists follow the ward rounds led by the specialist or the consultant, and they provide their consultation on the safety of the therapeutics prescribed, alternative drug therapy, double checking on dosages and orders to prevent medication errors. They also provide suggestions to manage the current medication supply available in the hospital. Next is the support staff, which are the clinical assistants and lab assistants. Clinical assistants are involved in a range of duties associated with the upkeep of the ward environment, cleaning medical devices, and to maintain the highest standards of cleanliness throughout. They are also responsible for giving out meals and drinks to patients and ensuring menu choices are complete and communicated to the appropriate department. As for lab technicians, they assist physicians in the diagnosis and treatment of diseases by performing tests on tissues, blood, and other body fluids. They most commonly work in hospitals or doctors' offices. You and your team highly depend on lab technicians as well as clinical assistants, so having a smooth relationship with them enables communication to work well to ensure specimens dispatched to the lab and processed promptly and results are communicated back to you as per the stipulated time frame. Next, we have the imagers and the record keepers. Imagers, also known as radiographers, are certified technicians who capture images of organs, bones, and tissue for patient diagnosis. Radiographers are equipped with the technological skills to handle imaging equipment and interpersonal skills necessary for patient care. You'll be coming into contact with radiographers while accompanying patients to the radiography unit. You may need to assist them with the patient's mobility and positioning patients for imaging. As for record keepers, they are responsible for maintenance of medical records. They must safeguard medical records from tampering, loss, and unauthorized use. They're responsible for seeing that the patient's right to privacy and the confidentiality of the information stored within the medical record is maintained at all times. Daily documentation and completing discharge summaries are important roles you play as a house officer. Ensuring documentation is appropriate and well done can assist the record keepers to organize and store them well for record and reference purposes. Next would be the telephone operators. To ordinary people visiting or calling into a hospital switchboard operator seems to be doing mundane work. In actuality, these people are wholly responsible for all the communication that goes on in a hospital. You will be dependent on the operators to connect phone calls within and out of the hospital, so good communication can be ensured if you're courteous and concise with your calls. And finally, the cleaners, who are the support crews, including the housekeepers and the linen managers. The role of housekeeping in hospitals is to ensure that all areas, including treatment and surgical rooms, patient rooms, labs, and public areas, are kept clean and sanitized. Linen and laundry services are responsible for providing a safe, clean, adequate, and timely supply of linen to user units of a hospital at the right time. So you and your ward members depend on the support crews as they keep your ward clean and safe from hazards. You play your role by ensuring sharps and waste are discarded well and pose no danger to the housekeepers. Linen managers appreciate your assistance in placing the used linens in their respective bags. Now let's move on to the operating theatre. Here we will meet the scrub nurse. The scrub nurse scrubs in earlier than the doctors or the surgeons to arrange instruments and complete the instrument count with the circulating nurses. They help surgeons clean and drape the surgical site under aseptic technique. They complete instrument count and inform the surgeons before the wound is closed. They check all the labels and patient's details for all the specimens taken and record them in the specimen book. Then we have the circulating nurse. Well, they receive patients from the ward in the OT airlock where they check the patient's details. They assist in instrument counting with the scrub nurse and they note them in the necessary forms. They help scrub nurses to prepare extra instruments as per requested or needed by the surgeons. And they always communicate with the anesthesiology and the surgical team. We will also meet the recovery nurse, and they stand by in the recovery bay to observe post-operative patients. They check the patient's details again post-operatively, and they make sure all the medications ordered are administered. They monitor vital signs and the airways. Finally, they pass over to the ward nurses upon signing the checklist and the forms. And lastly, we have the in-charge OT nurse. They make sure all elective patients are called to the OT as per schedule. They record patients' details booked for the emergency surgery in the emergency op form. They receive patients from the ward or ED in the airlock room, and they hold the keys to the dangerous drugs that are in the OT. Not forgetting the anesthesiology team. They will be dealing with the patient's airways and they will make sure the patient is optimized during the surgery. They will monitor the patient's vital signs and inform the surgeons if anything goes wrong. Now, let's quickly run through a flow of patient admission to the surgical ward to get some clarity. Patients are admitted to the wards either from the department's outpatient clinic or through the emergency room. Let's look through the clinic first. Here, new cases which are referred from other centers or follow-up of existing patients make the bulk of the cases. In the clinic, you will be tasked to collect new cases, do a follow-up review on existing patients' progress, and perform necessary tests or procedures if needed. If admission is indicated, the patient is then admitted to the ward. Similarly, as the patient comes or is brought into the emergency room, triaging is done, where the type and severity of the condition is assessed and determined. Based on the triage level, patients will be moved to the appropriate zones. The representative team members, which includes the house officer who are stationed at the emergency department, will review the patient by taking a detailed history, performing a physical examination, and interpreting relevant imaging studies of the affected area. Again, if admission is warranted, then the patient gets admitted to the ward in the same way. As the patient is admitted to the ward, the house officers have the first few contact encounters with the patient. Here, you are expected to review the progress of the patient from time of presentation to the emergency department, identify any new issues, request imaging studies, carry out procedures, place medication orders, and execute the pre-operative plans given by the operators. You also play a major role, which is posting a case for surgery to the operating theatre team and the anesthesiology team in order for them to get a pre-operative review done prior to surgery. Communication is key, and you should touch base with the operating theatre team to receive important handovers to be carried out post-surgery for the patient. And finally, we have the operating theatre. So in the operating theatre, you are responsible to assist the surgeon in positioning the patient, ensuring any wound dressing over the patient is removed to provide a clear area for surgery. You are expected to scrub in for the surgery to learn not on how a surgery is conducted only, but also to experience being in an operating theatre, as the environment is completely different from the wards and the clinics. Upon completion of the surgery, you could assist your surgeon with the documentation of the procedure. As a responsible house officer, you are encouraged to always communicate with the ward team as to whether there is anything to watch out for as the patients arrive back to the ward, or probably there are some specimens which are to be ordered by the ward team. This chain of communication is very important to ensure plans can be expedited and with reduced mishaps. Now, let's take a look at time management. Time management is extremely crucial to reap the maximum benefit of training during your housemanship. Let's look at a few general tips on how you could organize your task and use your time wisely. Tip number 1, create a job list. Make a customized table to summarize your ward works or tasks systematically. Prioritize work that needs to be done within office hours, such as requesting imaging, requesting special bloods which need specialist authorization. Cross out tasks that had been carried out to avoid confusion between colleagues, and delegate tasks among you and your colleagues, such as in blood taking, referrals, requesting imaging, assisting the medical officers in procedures as well. Tip number 2, familiarize with your patients and their surroundings. Get to know your patients well. Allocate 10 to 15 minutes at least to review your patients. Remember the important things about your patients and the significant results they have. Check necessary parameters and attachments on your patient, such as wound dressing, vital signs, and medications. Save the necessary emergency contact information for the day, such as the surgeon or medical officer in charge on call, as here in Malaysia, we do not use a pager system. Tip number 3, take turns with your colleagues if you wish to take a break, and notify your team members or senior colleagues on your whereabouts to ensure miscommunication is avoided. If you're working in the OT on that particular day, make sure you have your breakfast first, as you may not know how long or if the operation you need to assist may be prolonged. Finally, be early to reconfirm your patient's cases which have been scheduled for elective surgery. Write the patient's details on the board, prepare the medications as requested, prepare templates for your operative notes to save time in between each OT session. Last but not least, use electronic or digital productivity tools to enhance your productivity. Utilizing the reminder, notifications, and planner apps or systems can not only save your time, but also ensures tasks are completed. Apart from that, you do not need to worry about documentation, as you can always refer to the information saved. Now, what do you expect as a house officer? So you will also have the days where you'll be working in a cold operating theatre to assist your surgeons, but you might need to use more energy to help maneuver the patient if needed. Not to worry, because your medical officer and your medical assistant will always be there to assist your surgeon. Operations can take long hours depending on the type of surgery or procedure done, and if it gets more complicated intraoperatively. Ward rounds here will start early, as your surgeons will need to prepare for their OT by 8 to 9 a.m. So your duty starts at 7 a.m. Therefore, it will be advisable that you come in earlier to review your patients and discuss any problems regarding patients during the ward rounds. Before the rounds begin, for those patients with wounds or post-operative wounds that need to be reviewed, you need to remove the dressing and cover it with a sterile green cloth. Take note of all the plans given by the surgeon so that you not be missing anything. Surgery also has its own subspecialty, but only in certain hospitals if they have respective surgeons for each subspecialty. Now, as you progress through this specialty, you find yourself having an interest in this field and plan to specialize in it. So, how does one specialize in this field? There's only one pathway for attaining the qualification as a specialist in general surgery, which is the master's degree program through the Ministry of Education pathway, MOE, MOH. The program is divided into 3 stages. It can begin as soon as you complete your 2 years of housemanship program. Proceed on with registering with the College of Surgeons Malaysia to begin basic surgical training, which will span for 2 years with rotations in general surgical units. The College of Surgeons Malaysia is responsible to arrange basic surgical skills training, basic life support training, and science of tissue management. Outlined in this slide are the qualifications and requirements for application. On completion of basic surgical training, you may then apply for advanced surgical training or AST in programs that offer a recognized higher qualification, such as Master of General Surgery. The duration of advanced surgical training is a minimum of 4 years and may last up to a maximum of 7 years. Following successful completion of advanced surgical training, the other criteria such as post-qualification surgical experience a trainee must subsequently apply to the National Specialist Registry to be recognized as a general surgeon. The application process can be seen from 2 aspects, which are candidates from the Ministry of Health and the candidates from the Ministry of Education. So, Ministry of Health doctors can apply through the Sistem Permohonan Latihan Hadiah Latihan Persekutuan, HLP. Other applicants who are not from the Ministry of Health are required to apply at their respective university's graduate website. The application status can be checked online from 2 months after application procedure. Following application, the entry process is a 3-stage evaluation. It begins with applicants being required to sit for the Medical Specialist Pre-Entrance Examination or MEDEX for general surgery. Those who have passed then are required to submit their portfolios for review. The training portfolio is a compilation of evidence for training, learning and progression within the program and should be reviewed regularly. The training portfolio should include the learning agreement and the evidence of all training activities, assessments, as well as the continuous professional and personal development. Finally, candidates will be called for the interview, which is held in January every year, and upon selection, one can then begin their journey as they join the mid-year intake every year. Stage 3 is the Higher Surgical Training or HST, which can span from 3 to 5 years. Subspecialty training or clinical fellowship take place through various pathways and in hospitals that fulfill the training criteria. This may include an overseas attachment. Subspecialty training is for the acquisition of specific advanced skills such as breast oncoplastic surgery, advanced minimally invasive surgery, and traumatology, and requires a minimum of 3 years with a maximum of 5 years. This is the list of recognized postgraduate qualifications in Malaysia for general surgery. These are the local and overseas programs that are recognized postgraduate qualifications to practice as a registered general surgeon in Malaysia. You may find this list on the Malaysian National Specialist Registry website. Let's look at the subspecialties in surgery. So the major surgical subspecialties involving surgery are general surgery, plastic surgery, neurosurgery, thoracic surgery, colon and rectal surgery, and urology. General surgery is the parent specialty and now centers on operations involving the stomach, intestines, breast, blood vessels in the extremities, endocrine glands, tumors of the soft tissues, and amputations. So in summary, we have looked at what does this department essentially deal with, who are the essential team players that make this department, simple tips on how time can be managed well while training in this department, understanding the roles and responsibilities of a house officer in the Department of General Surgery, what is expected out of you while you are on duty as a house officer here, and the pathway to specialize in this field upon completion of housemanship training for those who are keen to join this field of surgery. Now let's take a look at the resources for training while you're in this department. This is the National Institute for Health and Care Excellence, or also known as NICE, which is an executive non-departmental public body of the Department of Health in England, which publishes guidelines in clinical practice. So NICE guidelines for surgical training includes information and support for people having surgery, enhanced recovery programs, pre-operative, intraoperative and post-operative care, as well as some information on managing pain. You can also find training videos and screencasts on their website. Next, we have here is the General Surgical Services Operational Policy of the Ministry of Health Malaysia. Now, this is a framework document and companion guide for provision of safe, quality, and patient-centered services for the Department of Surgery in Malaysia. It outlines the surgical service provision, clinical operational policies, roles of surgeons, and also subspecialties of surgery. However, very limited information was provided from the point of training and development in this field. Here we have the Johor Bahru Manual of Surgery. This is the first local guidelines which focuses on the essential information you need to know, providing concise and latest management of patient care in general surgery. You will find practical information on all surgical specialties here, all at your fingertips for quick review and reference. This manual is an excellent source of expert guidance for surgical registrars, medical officers, house officers, and others who provide care for patients with surgical diseases. We have the General Surgery House Officer Guide. This is put together by a group of doctors in Malaysia not many years ago. The interesting concept of a quick reference guide, which is used here, is helpful for immediate reference and recalling classifications. And finally, we have Geeky Medic's General Surgery and Surgery Notes. Geeky Medic's Surgical Notes is part of a compendium of a comprehensive collection of visuals, notes, flashcards, and many more interesting learning tools online for the Department of Surgery. Geeky Medics has an extensive compilation of clinical skills videos as well to assist doctors in training with their learning. Well, we have come to the end of this session. We hope this session was insightful and thank you for your time.